Okay, so today we're gonna no good.
That's fine. Perfect, actually.
All right, so today we're going to talk about life-threatening infections, diagnosis, and how to select drugs for them. So we're going to understand and apply terminology specific for life-threatening infections. We're going to list some factors for the development of infection that affect it. We're going to identify clinical manifestations of life-threatening infections. We're going to describe variables used to guide selection of antimicrobial therapy. And we're going to outline antimicrobial therapy for empirical therapy, or antimicrobial treatment for empirical therapy of some of specific infections. So 75-year-old nursing home resident with altered mental status and abdominal pain, loose stools, he's relatively hypotensive, he's tachycardic, he's tachypnic with a fever, and his SAT's only 90% on 2 liters of nasal cannula, oxygen. So do you think he has sepsis? What do you guys think? Yeah? So based on what? What do you think?
So based on his heart rate as well as his low BP, he's very tachycardic, and he has a temperature.
And the fever, right? So all those things, and 39 degrees is pretty hot, right? So sepsis is life-threatening organ dysfunction caused by the host response to infection. So you have to have an infection to have sepsis, right? And some organ dysfunction. Septic shock is when you have sepsis requiring vasopressors to maintain an adequate map, and usually associated with a lactate that's elevated because of decreased perfusion, right? Even with adequate volume resuscitation. And then, you can predict the high morbidity at the bedside just by looking at 3 things: patient's mental status, their blood pressure, and then whether or not they're tachypnic, so greater than or equal to 22 breaths per minute. And this is a SOFA score. I forget what SOFA stands for, but that's sort of a quick way to look at a patient to sort of see if it looks like there's an issue or not. So whenever somebody has a fever, right, it doesn't mean that they have an infection. So you'll hear me say to the residents, the only thing you have to do when a patient has a fever is a physical examination. See the patient, see what's going on, Then after you do that examination, then make some decisions about what you're going to do, okay? There are lots of things that can cause fevers, right? You have an operation, DVT, PE, drugs, sinus problems, all sorts of things. You always have to think about any catheter anywhere. So in a vein, in an artery, in the esophagus, in the bladder, all those things. All things are different ways you can measure the temperature, Usually within the sort of first 36 to 48 hours after an operation, some fever is probably normal. And you always have to consider medications when somebody has a fever. So what information do we need to figure out if this guy has a fever, the 75, has an infection, the 75-year-old? So what's that? So what kind of lab work?
CDC.
So white count specifically and a diff, right? What else?
BMP.
Okay. So BMP for organ dysfunction and blood gas, always a good way to look at organ dysfunction, okay. What else would you need to know to figure if the patient has an infection?
Is he growing any bands?
So bands might be, so you may have a bandemia in the setting of infection. What else?
Blood culture.
So blood cultures or other cultures of whatever fluid you think might be infected. And the other thing is, you gotta look at the patient. Does the patient have signs of pneumonia? Does the patient have signs of some sort of other pulmonary issue? Does the patient have signs of UTI, etc.? Okay. So the history is really important when you're diagnosing infection, right? Because you need to know sort of what the epidemiology of the problem is. Is it acquired in the community? Is the patient from a long-term care facility? Were they from another hospital? There are going to be certain predisposing factors that a patient brings with them. So the host is a big part of determining whether or not somebody has an infection. And then the clinical manifestations of infection, so the systemic symptoms like we just talked about with fever, end organ dysfunction, with pulmonary issues or tachycardia and things like that. And then there's site-specific fever issues or site-specific infection issues where we look at, pus coming from around the Foley or infiltrate around the central line and things like that. That has to be considered. So again, the signs of infection we discussed. Central nervous system. So somebody with a central nervous system infection, what sort of things might they exhibit? What sort of signs might they show? So they may have altered mental status. Remember, you can have altered mental status in the setting of infection, especially if you're an older patient, because that's a lot of time one of the earliest ways they show sepsis. But for central nervous, so specifically something like, meningitis. Right? What would somebody with meningitis, what would they have?
Pain
So they have what's called meningismus, right? Okay, what else? So fever, sometimes light intolerance, light intolerance, altered mental status, again, not necessarily the central nervous system. Whereas somebody with a respiratory infection, what sort of things do they experience?
Desaturation.
So oxygenation problems, tachypnea. So coughing up stuff, right? You'll say to me, oh, the secretions are really bad, or he keeps coughing up stuff, or what have you, right? Shortness of breath, things like that. Abdominal infection, you expect the patient to have abdominal pain, nausea, vomiting is a relatively frequent thing that goes with distension, right? Urinary tract, again, a lot of our patients have Foley catheters and are intubated on the ventilator. They might not exhibit that much at all when it comes to UTI, but if they weren't, so again, pain with urination, frequency, that sort of thing. Cutaneous infections are, I won't say they're relatively easy to diagnose, but from the outside you can see what? What do you see when somebody has a cutaneous infection? You see cellulitis, like so redness, heat, that sort of thing. And then for catheter-based infections, a lot of times you'll see, where the exit site of the catheter is, it's red, it's inflamed, there's pus draining from around it. So that's why we say when somebody has a fever, the only thing you have to do is actually go and do an examination. Go examine the patient. Let's see if you can find any signs of what's going on. So laboratory tests that might suggest infection, so you guys said it, white count, bandemia, or just the preponderance of polymorphonuclear leukocytes, right? So that may suggest infection. And then things to assess organ dysfunction, so lactate, BMP, that sort of stuff. You look at kidney function, you could look at, perfusion overall with the lactate. And then with an ABG, you get a lot of information, oxygenation, acid-base status, things like that. We talked about the microbiological tests, right? So one of the things we do early, you do a gram stain of the fluid that you send, just to look for bacteria. And then the other thing we look at are cultures, which, as we know, take a while. They don't go right away. And the last set of tests that we use are radiologic tests, CT scan, chest X-ray, that sort of thing. All right. So for this fella, the 75-year-old, tachypnic, hypotensive, tachycardic, and febrile, what sort of intervention should we do for this guy?
You're going to treat the fever as best as possible.
Okay. But before we even treat the fever, right?
Oxygenation.
He's tachycardic and he's really tachypnic. And I don't know if you've ever seen somebody breathing 50 times a minute. It's tough. Breathing 25 is tough. 50 is definitely tough. It's more than twice as tough, tell me, right? So this is the question is, does this guy need some sort of intervention, like intubation or something like that? Okay? And if you came and you said, oh, this guy really looks bad, Chase, I think maybe we should intubate. I think if I went over the bedside and I saw this guy, I'd be like, yeah, I think you're right, we should intubate the guy. So he needs help with oxygenation, and he probably needs help with ventilation at this moment, okay? So different patient, 7-year-old woman, had a lap chole, she's confused, she's coughing, she's vomiting, she's tachycardic, she's hypoxemic, her chest x-ray shows infiltrates, and she has an elevated white count. So, do you think she has an infection? So, before we say what's the source, do you think she might have an infection? All right, so now what do you think the infection might be? Why do you think she has an infection? Better question.
After the surgery, she needed septic.
Okay, so she could have an intra-abdominal source, all right. Do you think she's confused? Does that mean she has a CNS infection? So not necessarily. Again, as we get older, SICU, this is Jason.